This presentation will provide important information regarding open enrollment for the 2021 plan year for the City of Racine employees. I'm Melissa Kovacevic with the Horton Group, and we are a consultant for the City of Racine. During the presentation, we'll talk about what open enrollment is, provide a brief overview of the health plan, health savings account, flexible spending account, talk about the Racine Employee Health and Wellness Center, provide an overview of the dental and vision plans, as well as provide you with information regarding tools and resources that you have available to you. What is open enrollment? Open enrollment is the one time of year when you can make changes to your elections, no questions asked. So you can add coverage, terminate coverage, change the plan you're in, terminate dependents, add dependents, etc. Elections that you make now will be effective January 1st, 2021 through December 31st, 2021. The only time during the plan year that you can make changes to your coverage is when you have what's called a qualifying event. That is a change in marital status due to marriage or divorce, adding a newborn child or an adopted child, changing from single to family coverage, or adding a dependent due to a court order, or loss of other insurance coverage. Those are really the only reasons that you're allowed to make any election changes mid-year. Before providing an overview of the health plan, I am happy to report that the current plan vendors for the medical and prescription drug coverage will remain the same for 2021. Plan coverage will still be with United Healthcare, and drug plan coverage will still be with CVS Caremark. There are no plan design changes to the current 2020 high deductible health plan for 2021, so your plan design will remain the same as it is today. Here's a summary of the 2021 high deductible health plan for the City of Racine. As I mentioned, there are no changes to the current benefit plan, so if you are enrolled on the plan today, then these benefits may look familiar to you. You do have in and out of network coverage on this plan. However, I do want to encourage everyone to always stay within the network whenever possible. It's more cost effective for you and it's more cost effective for the plan, but if you did happen to go outside of the network, you do have coverage. I also want to remind everyone that this is a high deductible health plan, which is regulated, and in order to be an HSA compatible high deductible health plan, there cannot be any first dollar coverage. So that means that all of your charges must go toward your deductible. And once your deductible has been met, then you can have copays and coinsurance. So everything is going to track toward your deductible first before any copayments kick in. The individual deductible is $3,000 and the family deductible is $6,000. Your out-of-pocket maximum is $4,000 for an individual, $8,000 for a family. The out-of-pocket maximum tracks your deductibles, your copay, and your coinsurance. All of that out-of-pocket cost goes towards your out-of-pocket maximum. The coinsurance on this plan is 100%, so any services that apply coinsurance are paid 100% after you've met the deductible. The emergency room has a copayment of $200 after you've met your deductible. If you do happen to be admitted to the hospital, that copayment is waived. Urgent care has a $75 copayment after you've met your deductible. There is a telemedicine benefit, which is 100% after deductible. A primary care office visit is $30 after you've met your deductible. The specialist office visit copayment is $60 after the deductible. Preventive care is regulated by the ACA and it is 100% paid by the plan, so you shouldn't have any cost share for any of your age and gender appropriate annual exams. Just make sure that when you go and have your routine and annual exams that they're coding it as a routine and preventive exam. Prescription medications, they have a copayment after you've met your deductible, so your generic drugs will have a $10 copayment after the deductible. Preferred brand drugs will have a $35 copayment after the deductible. Non-preferred brand drugs have a $50 copayment after the deductible, and specialty medications have a $150 copayment after you've met your deductible. You may have noticed on the previous slide that it mentioned you had an embedded deductible. This provides an illustration of what that means, but essentially if I have a family plan, that just means that no one person in the family pays more than that single deductible, or essentially each person in the family is capped at that single deductible amount. We are staying with United Healthcare for the medical plan. So hopefully those of you that are enrolled on the plan today are registered on myuhc.com. We want to encourage all employees to be registered on myuhc.com. This is really where you have access to your own portal. You can check your current and past claim status. You can review your benefits and coverage, access ID cards, search network doctors and hospitals. You can look up costs of services. You can do some health surveys. You can do some online chatting with nurses. It really provides you with all kinds of tools and resources on myuhc.com. So please make sure you're registered. United Healthcare also has a mobile app. So this provides you with instructions on how to download the mobile app. You can download it from the App Store. Essentially everything you can do on the web browser on myuhc.com, you can do on the app. It is nice because that way you can access your ID card and you can show your ID card on your mobile phone. Most people have their phone with them, so it's a nice way to have your information at your fingertips. When searching your providers, you might notice that there are hearts next to their name. United Healthcare has a premium designation program. So essentially, they're taking their network doctors and they're tiering them within their network. We want to encourage people to seek out those 2 Blue Heart doctors. Those are known to have the highest quality and the highest efficiency. So when these doctors are evaluated, the 2 Blue Hearts mean that they're a premium care physician. 1 Blue Heart means that they've met some of the requirements and are quality care physician. No hearts means that they haven't been evaluated, and 2 gray hearts means that they do not meet the criteria that they would need to meet to be a premium provider. So again, we want to encourage everyone to seek out those 2 Blue Heart doctors. United Healthcare has a virtual visit benefit or a telemedicine benefit. So basically you would download an app on your tablet or your smartphone and you would be able to see a doctor for some chronic, non-emergent conditions. You would need to use your discretion, but basically they could treat anything from allergies, bronchitis, eye infections, flu, headaches, rashes, sore throats. A lot of people can use them for sinus infections. So if I need services, I know what I have. I know it's a sinus infection. Instead of waiting at an urgent care and paying that cost of that urgent care visit, I can call telemedicine and pay my $49 charge, and I would see a provider or physician. They are licensed physicians and they can also prescribe medication when necessary. They can't prescribe any controlled substances, but they could call in a prescription to the nearest pharmacy. You'd be able to pick it up. It's great for when you don't have time to go see a provider, or if you're traveling, you can use the app. We always encourage people to download the app ahead of time so it's ready to go and available to them when they need the services, as opposed to when they're sick. Then they don't have to mess with getting their account set up and everything set up. It's ready to go when they need it. This is just more information on the virtual visits. Because you are on a high deductible health plan, there does have to be a charge associated with a virtual visit. It's typically around $50 equivalent. However, an urgent care visit could charge anywhere up to $190 or so, depending on where you go. So the virtual visit is still a more cost-effective option for you. It's a more convenient option, so we want to encourage you to use virtual visits whenever possible. Because of COVID-19, some changes had been made to virtual visits. United Healthcare was allowing you to have virtual visits with no cost share for both COVID-19 and non-COVID-19 services. However, beginning October 1st, 2020, members will again have to pay that upfront deductible for your virtual visit for both COVID-19 and non-COVID-19 services. For any COVID-19 services for virtual visits, though, members will be reimbursed for those deductible amounts. There is nothing you need to do on your end to facilitate that reimbursement. That will be done by the provider, but know that the provider reimbursement process could take up to 60 days. That will currently be in effect until January 20th, 2021 at this time. United Healthcare also expanded a telehealth benefit. Telehealth is different than virtual visit. A telehealth allows you to see your provider that you would normally see via either phone or audio video and allow you to do your visit telephonically. United Healthcare was covering those services and waived any COVID-19 cost share for telehealth, and they will continue to waive the COVID-19 cost share until January 20th, 2021. Any services for telehealth that are non-COVID related still will apply toward your deductible. Because you're on a high deductible health plan, we want to encourage you also to shop around for your services. So United Healthcare has a tool on their portal called Find Care and Costs, where you can go in and you can estimate the cost of services based on what service you're having done and which provider that you're seeing. For example, if I need to have an MRI, it's likely more cost effective to have that MRI done at a freestanding facility versus a hospital setting. So it allows you to go in, again, through myuhc.com, so make sure you're registered, and you can price out different services and see what might be the most cost-effective option for you. This just provides an overview and gives you an illustration of where you might want to go for care, depending on the kind of service that you're seeking. For example, we don't want people going to an emergency room for a cold. We want you to seek out the most cost-effective option for the services that you need. The most cost-effective options are going to be your primary care doctors and your virtual visits, but you do have the option for a convenience care or a retail clinic, which you see at Walgreens or some of the Targets, Walmarts, etc. Urgent care is the next higher option, and then obviously emergency room is the most costly option. Sometimes United Healthcare might call you directly. I know most of us don't want to take a call from an unsolicited phone number, but sometimes United Healthcare does have a good reason for calling you directly, and we want to encourage members, or at least make members aware that United Healthcare might be calling for a certain reason, particularly for care coordination. So if you had a procedure and they're providing you with aftercare instructions, or providing you with information regarding medical equipment. They have nurses that can help you with your transition back home from a hospital stay. So we want to make sure that you're connecting with those care coordination nurses or disease management. So if you have chronic medical conditions like diabetes, coronary artery disease, they have disease management tools and resources and have skilled nurses that reach out to you with information regarding that. So we want to make sure that people are taking care of themselves. There is a good reason for them to call. They might also be calling for maternity support program information. So we do want to make sure that you're at least taking the call. They do leave messages and do provide a callback number. So you do know that it's them calling. If for some reason you can't remember the number and you want to call UHC back, you can always call the number on the back of your ID card and speak with an advocate. They would be able to get you more information at that point on the call that was made out to you and why they were calling.
Now we're going to talk about health savings accounts and some education around what health savings accounts are. A health savings account is a tax benefit savings account that can be used in conjunction with a qualified high deductible health plan. And the funds that are put into a health savings account or HSA can be used on any future eligible healthcare expenses, and they are not taxed. You're using pre-tax dollars to fund your HSA. Keep in mind that the HSA rules are determined by the IRS and not the City of Racine nor the Horton Group. So any of these things that we talk about are all mandated by the IRS and the government. High deductible health plans that are HSA compatible can only have the first dollar coverage on preventive care services. So your age and gender routine care that's mandated by the Affordable Care Act to have zero cost share to you are the only services that you don't pay out-of-pocket expenses for and should not go toward your deductible. Otherwise, all covered benefits must apply toward the plan deductible, including your prescription drugs. If that's not the case, then you cannot contribute to a health savings account. Who is eligible for a health savings account? It's any individual who is covered by a high deductible health plan that is HSA compatible. They are not covered by other health insurance unless that plan is also an HSA compatible high deductible health plan. They cannot be enrolled in Medicare, and they cannot be claimed as a dependent on someone else's tax return. Children can't establish their own HSAs, and spouses can establish their own HSAs, but only if they're eligible and if qualified by another HSA-compatible high-deductible health plan. HSAs are owned by the individual and not the employer. They're owned by you. The individual decides whether or not they want to contribute, how much to use, and which qualified medical expenses to pay from the account, and whether to pay for qualified medical expenses from the account, or you can save the account for future use. So what is an eligible or qualified medical expense? Eligible medical expenses are defined by the IRS under Code Section 213D. The expenses must be primarily to alleviate or prevent a physical or mental defect or illness. They're typically medically necessary. Eligible medical expenses can include dental or vision expenses as well as medical costs. So glasses, contacts, dental services, those can all be included as eligible medical expenses for the purposes of your HSA account. It also includes expenses that apply toward your medical insurance plan's deductible and out-of-pocket limits. So you can use your HSA to pay for your deductible costs, coinsurance, and copayment amounts. The listing on the next page are examples of eligible medical expenses, which are set forth by the IRS. The IRS is the ones who determine this list of eligible expenses. They could change over time, so if you have any questions regarding these expenses, you should consult a tax advisor if you need specific advice. So this is just the list of some qualified medical expenses to give you an idea of what you could use some of your HSA funds for. You can also use those funds for deductible, copays, and coinsurance, but you can also use them for these services. This is not an all-inclusive list. You can go out to the IRS website, or you can look at Section 213D to see additional eligible and ineligible expenses. Some of you may be familiar with FSAs or flexible spending accounts. An HSA, unlike a flexible spending account, does not have a use it or lose it rule. So all amounts in the HSA are fully vested. Any unspent balances in the accounts remain in the account and can carry over from year to year. That buildup of funds encourages account holders to spend the funds more wisely on medical care and to shop around for the best value for their healthcare dollars. So for example, using virtual visits instead of urgent care, going to a standalone imaging facility like a Smart Choice MRI versus a imaging service at a hospital, those are ways that you could stretch your HSA dollars. These accounts can grow over time through investment earnings.
Contributions into an HSA are also determined by the IRS. The limit for a single for 2021 is $3,600, and a family contribution cannot be any more than $7,200. For individuals that are age 55 or older, there is what's called a catch-up contribution that allows those older HSA plan participants to increase their annual HSA contribution to help them prepare for retirement and higher healthcare costs. That catch-up contribution is $1,000. It's pretty standard, and that amount typically hasn't changed. Contributions into an HSA account must stop upon Medicare enrollment. You cannot be enrolled in any part of Medicare and have an HSA account. You can still be able to use any funds that you've accrued into your HSA account, but you can no longer make any contributions into an HSA account once you are enrolled in Medicare. Remember again that contributions into an HSA, regardless of who makes them, are owned by the account holder, the employee, you, and remain in the account year over year until a distribution is made. So if there is ever an issue with your HSA, or there is a discrepancy that the IRS needs to clear up, they come talking to you. The city has nothing to do with your HSA account. That is an account directly owned by you. The city will continue to make contributions into the employee's HSA for active and pre-Medicare retirees that are on the health plan. Those amounts will be determined by the city and provided by the city. More information on that will be forthcoming.
This illustrates tax advantage savings. So in this example, this person reduced their net income by making HSA contributions with their pre-tax dollars, but then used those HSA funds to pay for their qualified medical expenses. Therefore, they came out ahead. Again, your funds can be used for any of your qualified medical expenses, and those distributions are tax-free as long as they're for those expenses. If you happen to use your HSA funds for anything that is a non-qualified medical expense, you could incur a 20% penalty. Please do not use any HSA funds for anything that is a non-qualified medical expense. Qualified medical expenses must be incurred on or after the date in which an HSA was established. That does not include other health insurance, including premiums for dental or vision care. So again, any of your out-of-pocket qualified medical expenses must be incurred on or after the date in which an HSA was opened. Can't be incurred prior to that. The HSA account holder should always keep your receipts. Again, the account holder is the owner of an HSA. If the IRS has questions, they will be reaching out to that HSA account holder. They may need you to provide that distributions from your HSA were for medical expenses and not otherwise reimbursed. The receipts could be required by an insurance company to prove that those expenses went towards your deductible, and not all expenses paid out of the HSA have to be charged against the deductible. It could again be used for dental services, vision care, etc.
The City of Racine also offers a flexible spending account that allows you to make pre-tax contributions to help you pay for eligible expenses that is administered by United Healthcare. The medical flexible spending account contribution limit is $2,750. The 2021 limits have not yet been announced by the IRS, but I am told that they're likely going to be the same. I cannot stress this next part enough. You cannot have a medical flexible spending account if you have a health savings account. So if you are on the City of Racine's high deductible health plan, you cannot have a flexible spending account if you have a health savings account. There is a 2.5-month extension or grace period to incur claims at the end of the plan year. The FSA also has what's called a dependent care flexible spending account. Contribution limit is $5,000, and this allows you to put money away to assist with childcare services while you are away at work. You can have a health savings account and a dependent care flexible spending account. So that one you are allowed to contribute money to if you have a health savings account. The FSA also has a use it or lose it rule, so if you do not use the funds that are in your account by the end of the plan year, you lose that money. Unlike the health savings account where that money rolls over year to year. Again, as I've stated over and over again, you cannot have a health savings account and a medical flexible spending account. The City of Racine is excited to announce that the Racine Employee Health and Wellness Center Clinic will be transitioning to Ascension as of October 19th. The location will remain the same, 2333 Northwestern Avenue. You can visit racinewellnesscenter.com or call 262-664-6640 to make an appointment. Hours are also listed on this sheet, so if you haven't already checked out the clinic, make sure you do so. In searching for cost-effective options, the clinic really is a great resource that you have available to you. You can use the clinic for any of your primary and preventive care services, chronic disease management, wellness services, coaching. Services available are for City of Racine employees and any dependents on the health plan. Dependents do need to be ages 2 and over, but again, they can serve as your primary care provider. They will collaborate with whoever your established primary care physician is. They can provide annual exams, physicals, prescribe certain medications. They can provide wellness services. They have certain procedures that they can do, such as skin tag removals, lacerations, etc. They can provide lab services. So if you haven't checked out the clinic or considered this as a resource, we want to encourage you to do that. Again, for most of the services, with the exception of preventive care, you will have a $4 charge, but a $4 charge at the clinic is way less than you would pay at an office visit setting or an urgent care for services. All right, so now we're going to switch gears to the dental and vision plans. For the 2021 plan year, your dental plan will still be with MetLife, and your vision plan will still be with Superior Vision. There won't be any plan design changes to the current MetLife dental plan and Superior Vision plan, so if you're already covered under these benefits, you won't see any changes for 2021. With MetLife, you have two different dental plan options. You have what's called the low plan and a high plan. The low plan is more of a preventive plan option. You have in and out of network coverage. The benefits are the same regardless of whether or not you're in or out of the network. However, if you do happen to see an out-of-network provider, those providers are not bound by any of MetLife's contracted rates, so they can balance bill you the difference between the MetLife contracted rate, and if they happen to charge more than that rate, they can balance bill you for that difference. So we always encourage you, again, to stay within the network so that you can avoid being balance billed for any amounts above those contracted rates. The deductible is $50 per person. Annual maximum is $1,500 per person. Your diagnostic and preventive coverage is paid at 100%. Your deductible is waived. Basic services are covered at 80% and limited to fillings, oral surgery, extractions, and emergency treatment. And then your major services are limited to oral surgery, endodontics, and periodontics, and are covered at 80%. There is no orthodontic coverage on this plan. So again, this is more of a preventive care plan option. The MetLife High Plan is more of the enhanced plan. This plan also has a $50 per person deductible, a $1,500 annual maximum, and does also provide in and out of network benefits, but again, want to encourage you to stay in the network. The diagnostic and preventive services are covered at 100% as well. Basic services are covered at 80%. And then major services are covered at 50%, but it also does cover crowns, repairs, adjustments, dentures. And then there is also coverage for orthodontia on this plan. It's 50%, and then you have your $1,500 lifetime maximum, and it's for children up to age 19. These are just some features of being part of MetLife. You have a large network to choose from. MetLife has some strong negotiated fees with their providers. You have access to pre-treatment estimates, real-time claims processing, 24-hour customer service that you can access either by phone, fax, or online. Hopefully, if you're already a dental plan participant, you're registered on MetLife.com. If not, we want to encourage you to register, and if you're newly enrolling for dental, make sure you register on MetLife.com. You'll have access to all of your benefits information. You can access tools and other resources, self-service features. You can access ID cards online through the portal. So we really want you to make sure that you're registered so you have access to all of your information and your dental claims. Finding a network provider is easy. You can go to MetLife.com, follow the instructions to search for a dentist. You can look up by zip code and see which providers are in the network. Again, it's more cost effective to see network providers. So if you're not on the plan today, or you happen to be in the market for a new dentist, make sure that you're checking for network providers. If you're on the vision plan today with Superior Vision, there won't be any plan changes for 2021, so Superior Vision will still be your carrier, and the plan design will be the same as what you have today. You do have in and out of network coverage, but particularly on vision, your money goes a lot further when you stay in the network for vision. So the in-network benefits, you have a $10 exam copay, a $25 materials copay. Your exams are covered every 12 months. You have a $130 frame allowance every 24 months. Your lenses are covered in full every 12 months. And then contacts have a $150 allowance every 12 months. You do have allowances out of network, but again, your money goes a lot further when you stay within the network. All right, so that was just a brief overview. If you need any additional information, there are more tools and resources posted online by the city. I know that for a lot of the United Healthcare programs and other programs that are offered, there are some Brain Shark videos available to you. If you need more information on virtual visits or designated providers, make sure you check out those videos. But to recap, there are no changes to the medical, dental, or vision plan designs or carriers. All employees have to complete open enrollment elections through the employee self-service portal. You can find a webinar and step-by-step guides on how to complete the open enrollment process through the self-service portal at the following website, so cityofracine.org/employee resources. So make sure you go and enroll for your coverage at that link. All employees have to complete their elections through the employee self-service portal no later than November 30th, 2020. So make sure you don't wait till the last minute to make your elections. You have to go out and make your elections on the self-service portal by November 30th. All employees must do that. For more information about benefits such as premium information, again, other flyers, resources, videos, tools, etc., go to the cityofracine.org link listed here, and you should be able to access any of that information. Really appreciate your time. So if you do have any additional questions about benefits, you can contact Human Resources at the number listed here. Otherwise, you should be able to find a lot of the information you're looking for at the employee self-service portal. So make sure that you check out all of the documents listed in there as well. Thank you and have a great day.